Good. Welcome back. Now, what to do now that we have learned how to stimulate all the reflex zones, or the majority of them, how should you behave when the first customer comes for a reflexology treatment? Given that you have not yet downloaded the analysis course of the second level, what you should do is ask a few questions. Ask them how they are in general, and you can already begin to take notes. I would recommend this, regarding what their habits are. Are they sleeping well? Are their intestines functioning well? Or do they suffer from constipation? Do they have any pains? Back pains? Shoulder pains? Ask if their period has begun. If a woman should tell you that she has an irregular period, you will go to stimulate the reflex areas corresponding to the ovaries, the uterus, and the thyroid, which regulates the menstrual cycles. I'm showing you here on the images the thyroid areas on the feet, okay? In the next video course, you will learn to diagnose the patient from their reflex areas before they tell you themselves. I want to offer an example. These here are the feet of a young woman, let's say around 30 years of age. And she is very active with sports, so she has excellent oxygenation of the blood. See the pink color of her feet? This is already an indication of her general good health. But, seeking to enter into the details, and I enjoy doing this because you will leave your customer with their mouth hanging open, you might notice this wrinkle here. See how deep it is? This is the area corresponding to the solar plexus, and it is quite close to the reflex zone corresponding to the respiratory tracts, which we have learned about in the other modules. Good. If this wrinkle is quite pronounced, it means that there is a lot of pain in the sternum. Not necessarily pain, but it does indicate a lot of stress. And this is the indication of a very tensed person. Moreover, as you see, there is a bit of a bunion, the crooked direction of the big toe. See here? This protruding bone? In this photo, we see one foot right next to the other. But in any case, this is a bunion here. In fact, when the big toe is so crooked, there is an overcharge of the cervical vertebra. What happens is that this customer has the cervical vertebra compressed. And this is the reason why this customer has come to me. They suffered from a lot of pain in the cervical area, which was causing repeated headaches. So what I did was to massage all the first cervical vertebra and release the bunion tension here in reflexology. As I will explain in the second course, there are some massage movements to perform exactly on the body. But those are part of metameric massage, a powerful instrument to release tension through massage. I don't want to get ahead of myself here. I will explain these things well in the second course, and you will have already understood something from the course we are finishing just now. In any case, returning to this foot, I was saying that there is this crookedness of the toe. Okay, we need to stimulate well the cervical vertebra and the entire spinal cord area and the paravertebral area. Now you know where this is. Another thing here is indicated by this wrinkle corresponding to the stomach area. As a consequence, if there is this wrinkle here, there is tension in the stomach, and this should be treated. The stomach is connected emotionally to all our stages of worries. So, where there's a lot of stress, one which might regard especially the family, when the brain perceives that stress, it somatizes that stress onto an organ, which is then reflected onto the feet through the nervous system. This is really the stomach that contracts in your gut and the body tends to hunch forward, as if to protect a weak area. To help you understand, imagine a young girl whose body is developing towards 12 or 13 years old. As her breasts begin to appear, she might sometimes tend to hunch forward, as if trying to hide her chest. These people with this type of problem in the stomach, which causes this wrinkle on the foot, with this tension, the body tends to do the same thing. Not beginning to become a hunchback, but still leaning forward. This is the reason for which the toes develop in this area, to compensate, to rebalance the body with this posture leaning forward. So, the bunion never develops by chance. It is not caused by shoes. I have had other customers, as you will see in the other video courses, who are housewives. During the day, they're wearing slippers, but they suffer from bunions due to this problem. Okay, perfect. Continuing with this diagnosis, you will learn that in the toes, in the tips of the toes, there are reflex zones corresponding to glands. In particular, in the fifth toe, there are areas corresponding to the adrenal glands, which is connected to emotions and the emotional state. This means that when the skin in those areas on the fifth toe tends to create corners, creating a sort of knife edge, it represents an overabundance of hormone from this gland, producing too much adrenaline, and as a consequence, creating a continuous tension. In fact, this girl suffers from bruxism, which, let me explain, is grinding your teeth, especially at night. There are various types. Some people just clench their teeth. Or there is when people tend to rub their teeth one over the other. As a consequence, they also wear down the surface of the teeth. In these cases, the dentist often suggests a mouth guard to protect the teeth. Now, I promise you that as I began to explain these concepts to this young woman who I had never met before, showing her the fifth toe indicating an overabundance of adrenaline, the area of the plexus, she felt as though someone was reading her in her intimacy. These are instruments of diagnosis. Another thing, we are looking here at a very healthy person. So, to close this parenthesis, which will be explained better in future video courses at the second level, I've prepared a lot of photos like this, in which I will explain, photo by photo, all the problems, and you will study them. I have prepared a technical sheet, and I will explain in the videos how to fill out these sheets to have an immediate picture of the person before they even begin to talk about their problems. Given that we are at the first level, now you have learned where the zones are, you must begin to stimulate them. Consider that a good reflexology treatment goes from 20 to 40 minutes. It is up to you to decide. Nothing is stopping you from taking an hour, especially given that you might be using the beginner's movement at first. If you have purchased the basic course, and you now know the entire body, you should be able to offer a good reflexology treatment and then body massage. If you have not purchased the first course, please do so immediately, because the price of that course is particularly low. But not because the value of that course is low. In fact, it is really the first access step to another series of courses. So I've kept the price low purposely to make my own reputation and to give you an opportunity to learn the basics. So, now that you have finished this basic reflexology course, I recommend passing to the next course, and you will have another strong weapon in hand. Someone asked me once, how often should plantar reflexology be practiced? The massage. Let's say that if someone should perform an entire treatment with you, once or twice a week is a lot, not more. Keep in mind that when you stimulate reflex zones, you are modifying the behavior of the body. changes take place both at the physical and emotional level. As I have already said, keep it in mind that reflexology is not mathematics. It's not 2 plus 2 equals 4. Let's say my cervical area hurts. Fine. I stimulate your cervical reflex area. You, in 1 hour, won't have pain anymore in your cervical area. No. You, with reflexology, are going to release a lot of tension in the nerves from the feet. And as a consequence, it is provoking the relaxation of an identified area, even if it hurts a bit at first. While you receive this treatment, I always tell my customers, try to resist for the entire period of the treatment. There will always be a bit of pain at an acceptable level. Be careful always not to make a mistake and create too much pain. The customers will not come back. Once or twice a week is the maximum to treat a specific recurring problem, such as back pain. Then you should be able to pass to once a week. From there on, ask the customer what they feel comfortable with, what they feel will be necessary. Perhaps you can suggest a group of 5, 6, or 7 sessions when they wish to come. One secret I always teach is to let the customer decide. I offer recommendation and then let them decide. Don't try to put a leash on them. The psychological pressure is out of place in this case. With these comments, I have now finished. Now, try to get as much practice as you can. You can write to me at the website, to my email. I will respond as quickly as possible. Please get practice, take notes, try to develop a certain sensitivity for the customer's feet. Don't perform the massage with too little pressure. The reflex zones are not on the skin, they are beneath the skin, and you need to stimulate the nerves there. Use some strength without exaggerating. The first video course finishes here. I am very proud of this course, and we will soon begin translating it into other languages, which will be a bit of work for us. Let me say goodbye, and thank you for your attention. I look forward to seeing you at the next level video course. Ciao, and a big hug from Italy.